No, actually, I think I'll stick with the background I had.
Good evening, everyone. I'm Mayor Sumbul Siddiqui, and I want to welcome you to our COVID vaccine town hall. I'm joined by a panel of community leaders who will speak to some of the many concerns we've heard from our communities of color here in Cambridge, and who will provide answers to those outstanding questions and concerns. As we know, this past year has been full of uncertainty and difficult moments, particularly for our city's Black and Brown residents. We've seen here in Cambridge, across the Commonwealth, and the country, that our Black and Brown residents have been disproportionately affected by the COVID-19 pandemic. And now that the vaccine begins to roll out to more people as we move through the state's COVID-19 vaccine phases, we know that there is some hesitancy among our BIPOC communities in getting the vaccine. And this hesitancy is very understandable and rooted in a history of exploitation. Whether you grew up during the Tuskegee study or during the Mississippi sterilizations on women of color, or just read about it, there's a huge history of exploiting Black and Brown bodies for medical experiments. And this research is part of our country's horrible history and medical racism. And these are just some examples that paint a very clear picture of why medical distrust continues to this day. So I hope that tonight's discussion builds some trust and provides a path to some transparent and open communication between community members and some of our community leaders joining us on this panel this evening. And I'm happy to say that we're joined by Claude Jacob, our Chief Public Health Officer of the Cambridge Public Health Department, Brenda Snowden-Downing, the Deputy Director of the Cambridge Housing Authority, Dr. Michael Payne from the Cambridge Health Alliance, and Superintendent Christine Elo from the Cambridge Police Department. I'm really happy to have all of you here tonight. So we'll begin our town hall tonight by inviting each of our panelists to briefly speak about their professional and personal perspectives about the COVID-19 vaccine, and then save most of our time tonight answering some questions from community members who have joined us this evening. And if you have a question, please do write it in the chat at any point during tonight's town hall, and I'll moderate the questions to our panelists. So with that, I want to welcome all of you again who've joined us, and we'll begin with Claude Jacob, our Chief Public Health Officer.
Good evening. Thank you, Mayor Siddiqui, for that wonderful introduction. And I'm truly delighted to be with you this evening for this discussion with our distinguished panelists joining for this conversation. I'm going to talk a little bit about our health department in the city and what we've done to date regarding vaccination of our local community, as well as outreach to our BIPOC members of the Cambridge community, given this very uneven experience that residents have had during this past year. Believe it or not, we're coming up on a year. And so before I dive in and at least share my story, I did want to provide a quick update just to put into context why we're here, what we've accomplished on the ground, and more importantly, just to talk a little bit about our ongoing COVID-19 response efforts. So first, let me just say the vaccine rollout, this has been the hot topic for the last couple months. Our department and city partners have been really busy vaccinating residents and first responders since early January. The vaccines are administered by our department and partnership called the Cambridge Pandemic Collaborative. It's a public-private partnership that includes the city, our health department, and members of our public safety partners on the ground. And I really want to thank the city manager and Mayor Siddiqui for helping to get this initiative off the ground last fall to position us to serve residents as vaccines become available. Again, we're talking about vaccine hesitancy. We're talking about the winter season, but really just want to signal that we've been at this for many, many months. And really thanks in large part to our strong partnerships anchored to the fire department, Pro EMS, the ambulance service. You'll hear from Superintendent Elo, can't say enough about the role of CPD, but really it takes a village to raise a healthy community, and the Cambridge Pandemic Collaborative is just one such example. So again, coming up this week, so to date, we've administered over 2,000 vaccines to those eligible in the phase 1 group. So we're talking about the first responders. We've activated a site over at the Cambridge side mall. We've also provided over 500 vaccines to area residents and staff from homeless shelters, and over 500 vaccines have been administered to these to the different senior buildings. Again, so thus far for those that are eligible. Our work standing up at least the clinic over at the mall, together with our on-site vaccination of homeless individuals and seniors in the CHA housing, demonstrates our ability to run a robust citywide vaccine program. Again, given the constraints, the challenges with getting ample vaccines in our hands so that we can get shots in arms, it speaks to our agility and our capability as a city. And I can't say thanks enough to the leadership here for helping to make that happen. I'm really proud of the work that we've done on behalf of the Cambridge community. In particular, I do want to thank again and acknowledge our fantastic crew, the Cambridge Fire Department, the Police Department, Pro EMS, our incredible staff who have been tireless in the trenches literally for over a year now, and deploying the different resources to conduct these clinics on site at the mall and also across the city. But to that end, the challenge, again, the state has declared that because of constraints with the availability of vaccines, that we do not have access to the first dose vaccines to support only clinics that are here in the city. So we're still adjusting to that reality on the ground, while the state has committed to supplying second dose vaccines to cover those already previously vaccinated, especially the shelters, the seniors, the staff. Just know that we are trying to make sure to encourage residents to take advantage of the designated mass vaccination sites. We've heard about some of the chain pharmacies or other retail locations like Costco and some of the supermarkets. So we're still working on a solution with partners to serve the needs of residents in the city. And this is really to include a broader array of regional partners, and that work continues. So to that end, in terms of the broader context, the state has identified 20 municipalities that rank higher on the social vulnerability index. Keep in mind that Cambridge is not among them based on our relatively our lower risk level. So we've been a moderate or low risk community for all these months. But we all know that there are vulnerable communities of color in Cambridge, despite the state's determination that even though we don't make that ranking as the top, the 20 most burdened communities. So our staff are compiling data in alignment with this index so that we can make the case for having additional vaccines available to us. So as the mayor mentioned, like elsewhere in the Commonwealth and across the country, Black and brown communities in Cambridge have suffered a disproportionate burden of illness due to COVID-19. And this has really exacerbated conditions that we've known of over time. Again, our BAPA communities should be considered a priority populations for the COVID vaccine, which is why we're talking about vaccine hesitancy. And we know about the long history and present day and this ongoing impact of racism, institutional and structural racism has had on communities from coast to coast. Whether you're talking about Chicago, LA, Atlanta, just know the large urban pockets have felt this weight over the course of the past year. So let me flip it and talk a little bit about what we've done and what we've been able to do using the talent and the assets in Cambridge. So we created what's called a Cambridge Community Corps. It's like a neighborhood ambassador program. And we decided to go old school to try to get to Black and brown folks across the Cambridge community. So we focused on the highest risk, the pockets of the community in higher need. And our team has really been on the ground since last summer. So starting out in the parks and playgrounds, pivoting to the commercial districts to get to the businesses, serving as the greeters of record for our COVID testing sites, and really now leaning in to help literally prime the pump by going to senior buildings, knocking on doors, and letting folks know that the next day or two that we come in with a team to at least provide shots in arm or the COVID vaccinations. I can't say enough about the talent that we've recruited. A number of the Cambridge Community Corps members are actually alum of CRLS, and I know that the mayor's an alum of CRLS. But just know that this really adds to the art of our work. Anchoring to the science of our work, we've been working on this research project in the city in order to develop clear and resonant vaccine messaging in order to focus on the needs in particular for our Black and brown members here in the community. So we've had interviews with trusted community leaders, and we're trying to make sure that we understand a little bit more about the experience, but also to package the messaging to be more effective on the ground. And we still have an ongoing community survey trying to call that information from residents. Let me at least put into context a couple data points, and then I'll end by sharing with you why I chose to be vaccinated. So for about a month now, we've been tracking some data by race and ethnicity, which has been made available through the state's database because they now accept this field. We're also still retroactively analyzing much of this information just so we can get a composite and a better picture of how well we're doing with covering the pockets of the community most in need. So a couple of quick examples. So back on February 12th, when we were able to hold a vaccination clinic over at the Cambridge Side Mall, we know that about 12% of the first responders, mostly that got their shots, were Hispanic or Latinx, identified as such. About 9% identified as Black or African American, but 2/3 identified as white. By the time we got to one of the senior buildings, we found that 1/3 of the participants identified as Black or African American. And when we went to one of the homeless shelters, or a couple of them, we pulled the data together, we found that about 8% identified as Hispanic or Latinx, about 1/3 identified as Black or African American, and about half the group identified as white. So we've been trying to at least get a better handle on whom we're vaccinating, and this really helps us to know that we're really getting shots in arms to folks most in need. So now that I've given a broader context, let me end by sharing with you the 4 reasons why I chose to be vaccinated. First of all, it's really to protect myself and loved ones. I know that there's all this debate about the vaccine and whatnot, but I really wanted to make sure that I took care of myself, but at the same time, making sure that I wasn't exposing others around me to the virus. I wanted to use that as a second point as a way to assure my family members, friends, and colleagues, and to demonstrate that the vaccine is actually safe. Again, depending on how much folks know about the data, whether you're talking about Moderna or the Pfizer, and now coming online, the vaccines from Johnson & Johnson, again, there's been this question around safety. So I wanted to at least assure family members, friends, and colleagues. The third reason, again, based on my eligibility, I wanted to practice what I preach, serving as the city's health officer here. And so I wanted to be able to demonstrate to each and every one of you, but also to my friends and colleagues, that I can practice what I preach. And lastly, given the legacy of institutional and structural racism and the impact on the quality of life for people of color, for the BIPOC community, I do feel that it's important for us to send a really strong message about getting vaccinated. Again, I'm trying to do my part as a Black male, but I wanted to at least make sure that we shared this message with folks. So let me stop there and just say thank you for allowing us this time and space to have this conversation tonight. I'm looking forward to the questions in the chat box. Mayor Siddiqui?
Thank you so much for providing your perspective and all the work that you and Cambridge Public Health have done from day one. It's truly been incredible. So I'd love to hear from Dr. Payne. Claude Jacob mentioned a little bit about the hesitancy and the mistrust, and talked about the safety. But I'd love to hear a little bit more about the safety of the vaccine, because that has been a question, and some of that historical context that we've discussed. Dr. Payne?
Thank you, Mayor Siddiqui. And that was an outstanding presentation by Dr. Jacob. I just wanted to pick up where he left off, as opposed to doing it at the end. Why did I get vaccinated? Very simple reasons. 1, I didn't want to die. 2, I didn't want anybody I loved to die. And 3, I've seen more death in the past year than I have in the 25 years of my career preceding it. You know, for me, this is not a theoretical exercise. I am a clinician. My background, I'm African-American. I'm originally from the south side of Chicago, Illinois. In fact, I'm sitting in my mom's house right now. A point I'll get back to in a second, visiting her. Moved to Cambridge, or moved to Boston when I was a young man to go to college. I went to Harvard Med School and then later to the Harvard School of Public Health, Harvard College. and I did my internship and residency at the VI in a Harvard training program. I did my GI fellowship at Tufts, New England. I practiced out in Western Massachusetts for 15 years, and then I came back about 14 years ago and started working for the Cambridge Health Alliance, which has been probably the best job I've ever had in my life. The dedication, the work of the people in the Cambridge Department of Public Health, the Cambridge Health Alliance itself as a hospital system, and the responders, the people who work in the Cambridge government to provide care is, I hope you realize how wonderful you have it if you live in this community. Because there are plenty of communities in this country, including my native south side of Chicago, that only wishes that we had this degree of service and dedication. So we're all very lucky. It was mentioned previously, the Tuskegee study might be a reason that Black and brown people are hesitant to get this vaccination. I mean, there's been a lot of discussion about hesitancy and the past racism that's existed in the medical community and how that creates distrust. Let's talk about distrust and let's talk about racism. The Tuskegee study was a study in which African-American men who were diagnosed as having syphilis were deliberately not given treatment to see what happened to them. It was about as racist as you could get. We were being used as guinea pigs, plain and simple. That is being taught in every medical school on the planet, has what you should not do. And I think folks got that. But what I find incredibly ironic is that the racism from that study is reaching its hand forward in time about 75 years and causing people in the 21st century who are Black and brown to die from a preventable illness. Let us make no bones about it. Whatever side effects COVID has, I mean, if it was to suddenly get rid of the little hair I have left or turn my nose green, that's a lot better than dying. The probability of having a reaction to the COVID vaccine is relatively small. So far, according to the Johns Hopkins data, as of today, 501,947 Americans have died from COVID, and in the state of Massachusetts, 15,853. So this is not a theoretical concern. This is a real and present danger. This is the #1 cause of death in this country. If you live in an area that has COVID, and if you're in the United States or in Cambridge, you do, there's a 10% chance of you getting this disease and getting hospitalized. And if you get hospitalized, there's a 10% chance you're going to die. Overall probability of death, if you get COVID, is about 1%. And that does not include the sort of secondary kills. So you didn't die from the COVID, but the heart attack or the kidney failure or the stroke that you got because you had COVID, yeah, you died from that. Most of us have never lived through anything like this. We have heard about it in history. I mean, I studied when I was doing my master's in public health. We studied the influenza pandemic of 1917 through 1920. By the way, it was 3 years, and it killed, in excess of 650 million people. But I'm sorry, 6 million, I think it was, people. But please understand, that was 3 years. By the way, World War II killed in excess of 600,000 people. That was from 1941 to 1945, and that was in the United States. So COVID has done about that much damage in under a year. So I just really wanted to emphasize the incredible threat that this poses to the health of the people who live in this community. Now, having said that, we mentioned racism before. For me, one of the pivotal moments in the civil rights movement was Rosa Parks refusing to sit in the back of the bus. The hesitancy that is being propagated through our community is guaranteeing us a seat in the back of the bus regarding getting preventative measures to avoid COVID deaths. So the question I raise is, where is this information coming from? Who is propagating this stuff? Because it is leading directly to mortality. People, we were just talking before the panel began, 500,000 deaths, and most of these people did not have to die. Preventative measures, wearing a mask, social distancing, would have helped kept this from happening. We did not institute those in a timely fashion. In Cambridge, we're actually pretty good about it. A lot of places are not. So I think that when we talk about the vaccination rollout, I guess this is one of the reasons we're so very passionate about it. Over 52 million doses of this vaccine have been given in the United States between December 14th and February 14th. The symptoms that most people get, I got, my mom got. My mother is 101. She was just recently vaccinated. She's fine. We're going out to dinner. She's intellectually with it, smarter than I am half the time. We got a headache. We got a little bit of, body ache. Some people get fever and chills. Some people may notice swollen lymph nodes or a little nausea. Stuff you get if you get the flu. There are occasional severe reactions, anaphylaxis. I mean, this is true if you go in. I'm allergic to lobster. You can get anaphylactic reactions. Some kids are allergic to peanut butter. Anaphylaxis means that you have a severe allergic reaction. You get hives. You may have difficulty breathing. By the way, when you get the vaccination, you have to stick around so they can watch and make sure you don't develop something like this. It's easy to treat. You give people Benadryl. You give people a shot of epinephrine, non-lethal treatments. The long-term side effects, could this cause long-term problems? Well, it's possible. It certainly can. But here's the thing. We do not live in a world that is risk-free. That's the great myth of America, that, if I do this, then I'll be okay. That doesn't exist. Every time you get behind the wheel of a car, there's a risk you could be in a car accident. Every time you take a shower, there's a risk you could fall and break your neck. Every time you walk outside and it's raining, you could be struck by lightning. But most of us drive to work or get on a bus. I hope most of us are taking showers. And most of us, when it's raining, we put up an umbrella or put on a raincoat and we still make it to work. So people in Cambridge, people in America, African Americans, we are not cowards. We will deal with predictable risk. And as I said before, the major risk of this vaccine is a sore arm. The major risk of COVID is a pine box. In terms of the efficacy, the Pfizer Moderna vaccines, which are mRNA vaccines, and people say, oh my God, is that going to affect my genome? No, it's not, period. It's a vehicle that's been used before. This was studied for years before the vaccines were developed. It was a perfect storm of scientific know-how and determination. The scientific community was on this. And they had developed mRNA vectors for transmitting vaccinations. It hadn't been applied to COVID. They asked, could we work this out with COVID? And it was a Black woman who said, oh yeah, we can. And as a result, they were able to start working on this vaccine and do the appropriate trials. Now, some people say, well, they did it awful fast. Well, honey, if your house is burning down, you're going to get the fire extinguisher awful fast. They gave the vaccinations to study groups, and before they had finished doing the studies, they were already manufacturing this, with the understanding that if the studies didn't work out, they're going to lose some money. Well, the reality is that for these two companies, the studies worked out. So they were ready to roll, which is why people have been getting vaccinations now, and they're trying to gear this up. I think that someone had mentioned we had cutoff dates for people being vaccinated in Massachusetts. Age 75 was, I think, one of the cutoffs. I am more concerned about African Americans not having access to this and other brown people not having access to this than I am to, well, we shouldn't get it. The average life expectancy for for Black people in the United States from the 15 census data in the CDC was 72 years. So by definition, most Black and brown people were going to be dead before they got the vaccination to prevent them from being dead. So I think that from my perspective, it is much more of an issue of us making sure we are in that line and not at the back of this bus. And one of the reasons this is important on a personal basis, I'm sitting here in Chicago celebrating my mom's 101st birthday. Remarkable woman, had a remarkable life, worked on the Manhattan Project as a medical technician, lived through Jim Crow South into Tennessee, moved up north, married my dad, who was a doc. I'm sitting up here enjoying this time with her, not wearing a mask because I got vaccinated in Cambridge because I work with COVID patients on a day-to-day basis. And she got vaccinated because she's 100 and was recovering from cancer. So we're both vaccinated. And when I got to Chicago, I stayed in a hotel, I got tested, I was negative. So since I'm negative and I'm vaccinated and she's vaccinated, I can hug my mom. So if you got loved ones you want to see, you want to get your life back to normal, get the damn vaccine.
Thank you, Dr. Payne. Really appreciate it. Really happy that you get to hug your mom. And, you know, we want everyone to, you've painted a really clear picture in my mind of why it is really important. And I think we can come back to that, the piece around access, because that is something that is a concern. And we've already heard, we have a question in the chat about, you know, I'm ready to get vaccinated, but where do I go and when will I get it? So that is in the back of the people minds. And so it is really paramount to this discussion as well. So now we'll move to Superintendent Elo, who is a first responder and was one of the first people the Cambridge Public Health Department had the vaccination clinic for. Would love to hear about your work and what you're hearing, why you received the vaccine.
Yes, thank you, Mayor Siddiqui. Very powerful words from Dr. Payne. I can really appreciate that. And I was just pleased to be asked to be part of this panel, just to share my perspective as, number one, an African-American woman who grew up in the city of Cambridge, went through the Cambridge public schools. And I wear a couple of hats. I am also, besides a police officer, I'm a mother of twin 15-year-old boys who are freshmen in high school. I'm also a daughter of elderly parents who live in senior housing. This has probably been the most difficult year that I can remember really in my life, not just in my professional career. Being on the front lines with other people on the panel has been really challenging. Time away from our families, time away from our friends. And of course, we're risking, exposure to COVID-19, protecting our community. That's what we do. There have been so many unknowns. One unknown, I have my son who is a freshman in high school, has not stepped in school once in the past year. My other son is hybrid. I have, similar to Dr. Payne, I have not hugged my mom or been able to visit my mom in over a year. And then there are unknowns about the vaccine. It's so new. And like so many, I had my doubts. But at the same time, watching friends and family contracting COVID-19 and suffering the consequences, and the numbers, 500,000 deaths, that is just staggering. I knew that when a vaccine became available that I was going to get it. Number one, I want to hug my mom again. I want to see my kids back in school again. The first dose that I received, minor arm pain, wasn't a big deal. The second dose that I received 2 weeks ago was a little bit worried. There were lots of concerns that the second dose is going to be worse than the first. But as Dr. Payne talked about, there was a little bit of fatigue. I was a little bit tired. I actually cleared my weekend. I was able to get my vaccine on a Friday. And I said, Friday night and Saturday, I'm not doing anything. But, remarkably, I was fine. And I was able to get up. I took a Tylenol and I was totally fine. We were really fortunate here in the Cambridge Police Department because we were one of the first people to get the vaccine. One of the things that we did was we polled our officers because we were really trying to see how many officers would voluntarily get the vaccine. Only about half said they would. And we were really disappointed in that number. So what we did was really pre-vaccine process. We just flooded our officers with education, pamphlets, factual information. We're fortunate enough to have a registered nurse on staff. Deputy Wells worked really closely with Claude and his team from Public Health, along with Cambridge Fire and Pro EMS. Our officers had, access to information to ask questions. And thankfully, ultimately, we were able to get, through all the education and everything, just under 80% of our officers got the vaccine, both vaccines, and everybody is fine. So we're really thankful. And now that I'm vaccinated, my parents are vaccinated. We made plans for dinner. So next month, I'm going to be able to see my mom, and I'm really excited about that. When my sons are able to get vaccinated, they will be vaccinated. We've already had this discussion. And what I would say to people that are reluctant, listen to the healthcare professionals. They're not going to steer you wrong. And this is our path to having a more normal life. And I hope by September, both of my boys are back in high school and can enjoy their high school experience. So thank you for letting me share my experience.
Thank you so much, Superintendent Elo, your experience. I think, the more we hear about how, just organizations like the police department went through that educational those learnings, getting the facts out, it's critical. And I think that is what it's going to take to make sure that we get as many people vaccinated as possible. So last but not least, I want to turn it over to Deputy Director of our Cambridge Housing Authority, Brenda Snowden-Downing. I would love to hear your perspective. The Cambridge Housing Authority has been such an amazing partner in our city's efforts as we combat this pandemic. So thank you so much for all that Cambridge Housing Authority has done for us.
Well, thank you, Madam Siddiqui, Mayor Siddiqui. And first of all, I just want to thank you, one, for convening this most important panel. And I also just got to give a shout out to Dr. Payne, because you shoot straight with no chaser. And I think that, your words are really going to help a lot of people, because it's one thing to hear from someone on the street saying, hey, yeah, I think it's safe, but to hear from medical professionals like yourself and like Claude, I think people need to have access. And I think that's one of the reasons why people distrust the system, because they don't have access to the people that can give them the information. So for me, I'm probably one of the only people on this call who has not actually been vaccinated yet. Just because I have not, or Mayor Siddiqui too, okay? Just because it's not my turn. However, I stand ready and willing to be able to get the vaccine when I'm able to do that. As a woman of color, I feel obligated to equip myself with all of the knowledge that I can get. So forums like this are super important for all of us. And I'm painfully aware of the distrust that exists with people of color, because in the past, the healthcare system has failed us. And I think that there needs to be a lot to remediate that issue. There needs to be a lot more about training and access and breaking down silos of information. I think there are a lot of people that don't get access to the information, and that's what gives us a lot of the hesitancy. CHA has been very fortunate because the city of Cambridge has been such an amazing partner, and they've been able to allow us to get access to the vaccine for our elderly residents. We have, I believe, as of now, I think we have offered that vaccine to about 800 residents. And so I say offered because, there are always some changing with the numbers. For instance, some folks weren't home, or some folks had children that already helped them to get access to a vaccine somewhere else, or, someone had spoken to their doctor and the doctor had gotten them vaccinations. And I think by the end of this week or early next week, we will have, I believe, allowed vaccinations for our residents in all of our elderly buildings. So that is a huge plus. And it's great because I haven't heard a lot of folks I haven't heard tale of a lot of folks refusing the vaccine, because they were afraid. But I do know that hesitancy exists. My mother-in-law, she's 87 years old. Dr. Payne, I'm going to need to get your mother's phone number, because she is like, absolutely not. She doesn't want it. My husband and my sister-in-law and her husband, they continue to try and talk to her, but it's the historical content for her. And so, but I think panels like this that lead to positive messaging and allow folks to get information, I think is so very important. Like I heard someone say recently, people will care about what we know when they know that we care. So it's forums like this that allow us to be able to disseminate information and make people feel more comfortable. But I think at the end of the day, a lot of it comes down to access, and it comes down to knowledge. So again, I am looking forward to getting the vaccine when it's available to me. I want to thank Mayor Siddiqui for this opportunity to be here on this platform. I hope it's not just one, because I think we have a lot of work to do. And I think that we need to continue these conversations because sometimes the people who have the least access to the information are the ones that get hurt the most. Like Dr. Payne said, I don't want to die, and I don't want to see anyone in my family die, and I don't want to see the terrible number that we're looking at right now of 500,000 deaths that didn't need to happen. And I'm feeling, as a Black woman, I'm feeling very confident about receiving the vaccine. If you had asked me 6 months ago under another administration, I probably would say no, I would not receive the vaccine, but I stand at the ready to receive it today. So thank you very much.
Thank you so much for sharing your perspective. And like you said, I've not been vaccinated, but I look forward to when I can. We were able to get a vaccination for my mom for Thursday. So I'll be taking her to Fenway, and she's so excited. She's just like, oh, I can't wait to get it. But then my father, on the other hand, who, they live together, obviously, and he said, I'm really worried about any reactions. I have a history of allergic allergies, and we've talking through that, and I think we've finally gotten to a place of, to getting him somewhere. But again, it's remarkable that two people who live together, and one is on this, who is so excited, we got the appointment, and on the other hand, my dad is saying, I need a little bit more time. And I've said, with what Dr. Payne has said, this is life and death, right? You're diabetic, you have comorbidities, you should get it. And we'll get him somewhere. But, he's actually had some questions that I think other residents have had, and maybe Dr. Payne can speak about it. One of the questions that has come up about the trials has been, how diverse have they been? I think that's something that many want to know.
I can refer people directly within the age of the internet to the New England Journal of Medicine, which published the Moderna and the Pfizer data. The trials were very diverse. They specifically looked at that issue. And so there were large representative samples of people who were not white that were in those trials. They also had an age range with Pfizer going to age 16 and folks who were much, much older. So they made a significant attempt for both of those studies, and also the AstraZeneca and also the Johnson & Johnson studies, to diversify the people who were being tested.
Thank you. That's really helpful. I think it's important to share that these studies, not only, it's great to hear from those who've been vaccinated, but to have these studies and say that this was top of mind for these clinical trials, I think is really important to share. So I want to go back to the access piece. I think what I am seeing is that, people are trying to make these appointments. They're not having much success because the supply is limited. And what I hear is that in turn is having an impact and making, our residents feel, even more left out of the public health solutions. And so I want to go back to Claude here. I think, our city has said time and time again, we would love to vaccinate. We have the capabilities to vaccinate, but to make it clear to the public, we have, as much as we can advocate, there are some bottlenecks. So I think in your role, Claude, could you just share a little bit more about how you are advocating and how Cambridge is advocating for increased access?
Thank you, Mayor Siddiqui. It's an important issue. Let me just frame it in sort of three buckets in terms of access. Again, over the course of the last few weeks, depending on one's eligibility, you may have seen talk, you just mentioned, Mayor, about taking your mother to, say, Fenway. Fenway, just like Gillette Stadium, they are what are called these mass vaccination centers. So whether they're statewide or regional, but just know that that's bucket number one. Closer to home, we've mobilized and activated a municipal vaccination clinic, like the one that we have over at the Cambridge Side Mall. So we've created a space, we've staffed it, we've gotten vaccines from the state. They did give a directive to local boards of health and local health departments to vaccinate, for example, first responders like Deputy Superintendent Elo. So that's bucket number two. So there are the mass vaccination sites. Again, the municipal ones I'll come back to, but just know that that has been an option and it keeps changing. The team that we've used most recently, it's the mobile teams to go out to the homeless shelters, to the congregate care sites, to the senior buildings. So that's bucket number three. So when it comes to access, we've demonstrated our ability to stand up a clinic like we did with Operation Nightingale. We've at least made sure that we get the vaccines through the Cambridge Health Alliance to us. We manage that. We keep track of the inventory. We make sure that shots are in arms. That literally over the course of a matter of just a day or day and a half, I can tell you that we've had over 90% of our vaccines literally out the door. And right now we're making sure to advocate for more vaccines, demonstrating that we have throughput, that capability because of our teams, supported by the fire department, by the ambulance service, Pro EMS, and by our staff of our department. So we've been advocating to make sure that we get vaccines in hand for us municipally. We've used the limited doses to get to the higher risk groups across the city, which is why we've made it a point to go to these on-site or mobile teams just because of the constraints tied to the vaccines. That being said, we've been collaborating, chatting with some potential partners to establish a regional vaccination center in this metro area to make it easier for residents rather than having to try to make it across the river to say Fenway or trying to get to Gillette or trying to get to Danvers. We know the constraints, whether you have access to a car or whether there's public transportation to get you there, or whether you have access to a companion or caregiver to get you to that vaccination center. So we see the challenges in that, which is why we've demonstrated our capacity and our capability on the ground. At this time, the state has notified local boards of health and local health departments that there is going to be a constraint and a restriction for accessing that first dose. And it's not just us. Again, other outfits have seen the same challenges because of the limited vaccines that are making their way to the Commonwealth. The option right now for residents, if you can book an appointment, I know that there have been challenges or concerns, especially over the last week, that is the main option for folks right now. If you happen to be a patient of, say, Cambridge Health Alliance or Mount Auburn or your healthcare provider, there are different conduits that residents may have depending on their provider network. But for us on the ground, we're making sure to take the limited vaccines to the pockets of the Cambridge community, which is what I shared earlier, how we've gotten to the homeless shelters, the congregate care sites. We continue to have at it to make sure that we cover our elderly populations, the higher risk groups in the city. And we're awaiting guidance from the state because now they're asking local health departments to try to get a little bit better connected to the homebound residents and those groups of higher need in our different cities and towns. So more to come. We're asking folks to be patient with us. We know it's been a long year. While we do see light at the end of the tunnel, we're asking folks to just let us know. So contact our department if you can, and let us know if there's a way that we can at least help you navigate, because that's the best thing we can do right now.
Absolutely. And I think, you know, what's been painful to see is that, you know, I don't want our BIPOC communities to equate this access, you know, to that their health doesn't matter, right? Like we want to vaccinate. We want to vaccinate you. We want there to be vaccines, and we're also waiting guidance. And so I think with this new administration, at least, we've seen the supply go up. We've seen some of the prior bottlenecks be fixed. There are going to be, there's going to continue to be some bottlenecks, but I think it's great that we're trying to do as much as we can. And for those who are having difficulty, as Claude said, contact the health department, contact my office. We'll do everything we can to try and help you get an appointment. There's also state resources 211. Even though, it could take 7-8 hours to get a call back, but we want there to be opportunities for you to get that vaccine, and so we'll definitely share that information. So now going back a little bit to the education piece, I think I am curious about hearing from you, Superintendent Elo, a little bit about what you've said to what you've heard, what the registered nurse had said to the first responders to convince them, and any other interesting conversations that came up.
Well, specifically, I wasn't part of those conversations, but just to provide the factual information, I think the Public Health Department and the Cambridge Fire Department, along with Pro Ambulance, have just been there as resources to our officers. So if people had questions, they could email somebody. Deputy Wells she did a fantastic job just making sure she had access to officers, wondering if people had questions and just making sure that people could answer those questions. What specifically they were, I wasn't 100% sure. One officer I know particular was just really anxious about getting the shot, even just with all the information that that was provided. So we ended up having another officer go with her to get the shot, and she is fine and feels so much better today. So just being able to have questions answered was really critical for officers, and then having support there if they needed it.
I think everyone needs a buddy, right? in terms of what the vaccine is. So we did get a question for Dr. Payne to talk about the COVID variants and what we should know about that, and if the current vaccine will work against them.
Okay. So here's the thing. This virus is a life form. We humans are egotistical, and we think of ourselves as being the apex of evolution, on the planet. That's really kind of a very prideful boast, because we're one species out of millions of species that exist on this planet. And some of the most successful species there are microorganisms like viruses, who have been around probably as long as there's been multicellular life. That's about 4 billion years. They're really good at what they do. And this particular virus mutated and discovered that human beings were a great source of food. Have you ever decided you wanted to go out and you wanted to eat Chinese food or Indian food? Well, COVID said, hey, let's have human. And it became all the rage. So what happens is viruses, when a human being multiplies, we may have one, at the most, 3, 4, 5 children at a time. When a virus enters a cell, it can make anywhere from 100 to 1,000 copies of itself. And you've got, there's 1 trillion cells in the human being, but it only affects a small percentage of that. So we're talking basically about one virus, once it gets going, having literally trillions of offspring. And each of those offspring has an opportunity to have genetic drift, to change its genome a little bit. Now, most of the offspring are idiot kids, and they actually can't even infect cells. But the few million or 100,000 that can are very successful in changing. So that's why you get these changes that occur, these mutations, these variants, okay? And the variations are little subtle minor things, but it makes it very hard to come up with therapeutics. I mean, how successful have we been at coming up with a cure for the common cold? So the way the virus works is it's wonderfully simplistic. Its entire existence is based on the following. This is a human cell. The virus basically, specifically cell in the respiratory tract, and cells, we think of cells as being these little boxes you learn about in biology. That's not true. Biology is this marvelous thing. Cells, go out in the countryside and look at a hill and look at the trees and the grassy parts and all of the life forms around it. That's what cells actually look like. They have little antigens or pieces of protein that come out of them that allow them to recognize each other. Cells talk to each other. Now, they don't have lungs. They use markers, these antigens, to communicate. The virus takes advantage of that, and what it does is it looks for a specific marker, and then it comes down and it latches on. And it's like a lock and key. So what happens is when we create a vaccine or a medicine, the idea is to basically block that marker the virus, so that it can't latch on to this particular protein. Well, the virus goes, and some of its kids down the line don't have the same shape. They come up with a slightly different shape. And this medicine is ineffective against it. And this different shape has no problem in latching on. So what happens is when you come up with a vaccine, or next best thing is this thing called passive immunity. It's where you take somebody's blood who had COVID and you give it to somebody else, the part of the blood that has antibodies, the proteins in your body that fight viruses. You're basically giving them your immunity, what we call passive immunity. So the vaccine creates active immunity. You make your own antibodies, or passive immunity. Pardon me, brother, could you spare an antibody? So what happens is that the antibodies that we create can stop the wild type, but then the mutation, it's not as effective against, okay? But that's okay, because the problem we had with COVID is we had no antibodies to this. We had absolutely no immunity. I mean, it's like looking at the Patriots line and all of the offensive line is just gone. The quarterback ain't gonna have such a good day if that occurs. So the vaccine gave us an offensive line. So the other team comes up with some new plays to get around that line. So yeah, if you get the variant, you might have a slightly higher chance of getting sick, but you're not going to get overwhelmingly sick. The people who got the vaccination when they got variants, and they've looked at this now over the past few months, those people don't die. They don't get really sick. I mean, a few get really sick, but most of them don't even get really sick. And if the worst that happens is you get a cold, I can live with that, literally. Well, is that drift going to continue? We're going to see worse and worse variants. Well, probably. But you know something? Last time I looked, them vaccine companies still working. This is what happens with influenza. 1918 influenza killed more people than COVID's killed so far. They didn't know how to make vaccines, but when they learned, well, that's why we all get influenza shots every year, or you should be. The influenza virus keeps mutating, and we keep coming up with new vaccines to fight it. And the same thing's going to happen with COVID. So in about 6 months to a year, they're going to say, time for your booster. My suspicion is they may want to give you your flu shot and your COVID shot at the same time. And that works for me. Because like I said, the choice between being alive and having to go back for another appointment, which is inconvenient, and being dead, I want to be in that really long line. You know, the ones waiting for the vaccination.
Thank you, Dr. Payne. I think all of us on the panel, we're learning so much from you, and especially this explanation about the variant and the role of the vaccine. So I'm still reflecting. So thank you so much for sharing. I think one thing I am curious about with the Cambridge Housing Authority in particular, Brenda, first I want to kind of know a little bit more. I know you said last election or last term, with the old administration, you had some hesitancy, and now, you feel much better. Can you say a little bit more about how you overcame your hesitancy? And then with the Cambridge Housing Authority in particular, can you speak to how the authority gets information out to residents?
Gosh, got to find that mute button faster. So I think, as far as Cambridge Housing Authority getting out the information, we use a variety of different outlets, right? So we've done a lot of flyering to residents, delivering. We deliver notices, a lot of the notices that came from public health, even back when the pandemic first started, we delivered masks to our elders, and but not only masks, we gave them information on the proper way to utilize the mask, and we talked about making sure that they're washing their hands, and we really ramped up our maintenance staff to do a lot of sterilization in the buildings, all the touch points. The management staff was still manning the offices. So folks who had questions could still call, you could email. We mobilized our staff, so many of them who were working at home were still covering calls and answering phones. And, the great thing about, communication works is when everybody participates. So if someone had a question that we couldn't answer, then we would reach out, whether it be to Claude, or we would reach out to somebody so that we could get the correct answer and make sure, that folks were equipped with the information so that they can make decisions that, best suited their lifestyle. And for me, I think, some of my hesitancy, again, is historical. I think back to, of course, we all learned about the Tuskegee experiment in school, and that was still very, very prevalent in the forefronts of my mind. And also, it was just about the delivery of the message. Like, I think that you have to be comfortable with the messenger. So, like I said before, Dr. Payne, he pulls no punches, but you're hanging on every word that comes out of his mouth because it's a nugget of information that is really helpful. He's not talking down to you. He's talking at you. He's telling you based on his professional experience and his personal experience, what he feels is best. And I think that that's important. So there was a lot, there was a lack of information, but even the information that came out, it was very disjointed. It was very protected. It wasn't as forthcoming. And I think that people want transparency, particularly, in communities of color. So I think that's where a lot of the hesitancy, at least for me, came from.
And I think you touch on a really, important point. It's who the messenger is. And I think especially in Cambridge, as we think about answering questions, who should this come from, right? Who will residents trust? And who would residents want to get information from? Of course, each of us can share. I think those who've been vaccinated can share their experiences, and I think that's a critical piece of it. But who are those influencers, right? And I think what we've seen is that we do need these influencers in our community to really. It's a grassroots. I think it's going to have to be grassroots. And I think, Claude, you've mentioned our community core. I think there's more work that is being done around focus groups, around who we can actually use as these messengers to get that information out. So I think that's critical. The survey results, could you say a little bit more about the survey that's come out? It's due Friday. I want residents to be able to take that survey. It is offered in multiple languages, which I think is important. And I think if you could say a little bit more how we're going to use those results to inform further work.
Thank you, Mayor. Yes, again, just zooming out, the challenge with this pandemic that we've had over the course of the year, it's the wear and tear and the fatigue, the fear around this virus. The other battle for us has also been around this infodemic. Again, the lack of trust, whether you attribute it to the disconnect to the federales or what we're seeing tied to some of the misinformation that's out in the ether. So we decided, we made a decision here in the city to lean in a little bit more by designing a multi-phase vaccine communication plan. So it's by design. I can't thank enough my team that's really taken this on in concert with the mayor's office, with the city manager's office. But the overarching goal is to increase trust in a COVID vaccine, resulting in a higher percentage of residents, with the uptake. So we have a very diverse community. We've talked a little bit about the history here. Communities have long memories, through generations, these stories are passed down. And so we wanted to figure out a better way to get feedback. So we put out the survey. We've had over 1,300 respondents so far. The survey is scheduled to close at the end of the week. It's in 8 different languages. So we're really trying to at least get across language, culture, and hue so we can get a better sense of what is the types of information that people need. Who are the trusted sources, the messengers, to your point, Brenda, that makes a difference. But we also want to figure out the message itself and the different channels. So just know that we're anchoring the science to our work by going through this process, by doing interviews with key informant key stakeholders in the community, but also looking at the art of how we can become better at getting the information out. Let me just acknowledge the Cambridge Community Corps, for example. Last summer, the reason we moved to this model, again, most folks forget that there was all this debate around masks. Believe it or not, again, not as much of a debate here in Cambridge, but just know that at some places it was a debate and still continues. So we wanted to make it a little easier for residents to understand why we're doing this. So while folks were out and about in area parks, tot lots, and playgrounds, we decided to deputize these ambassadors. So mostly 20-somethings who are familiar with the Cambridge community. They know the pulse of the city. While we have these executive orders signed by the city manager and Dr. Saya, we also wanted to use an educational opportunity, a teachable moment in the parks. Let's have a conversation. Let's talk about why it's important to wear a mask. Let's hand out some hand sanitizer or Purell, just to engage and help folks getting through this experience that we're having together. So that group, recognizing that they are a trusted source, they're recognized, we've imported them from the parks and playgrounds and business districts to literally being the door knockers, to go to the senior buildings and say, hey, Mrs. Jones, just so you know, in case you don't know, you are eligible. And by the by, we're going to have a team come by tomorrow or the next day. And we found that to be really cathartic, helpful for folks. So I just want to acknowledge, besides the survey and our broader plan, that we're also working with the people power on the ground, like the Cambridge Community Corps, to get out there to connect with residents.
Definitely. And I think, I think as the weather gets better, we've talked about doing things outdoors, with the capacity limits, but making sure that, we are going to people where they're at and answering questions that they have. I think that will be a, considerable part of getting the word out and the educational piece. So thank you for that. So I wanted to go back to Dr. Payne. I am curious to hear, and one of the questions we've gotten is, what are some of the top myths and fears maybe your patients have expressed, and how you've dispelled them?
Top myths. It's going to give me COVID. No, having somebody breathe near you and the spit containing the COVID virus getting in your mouth and nose or eyes will give you COVID. The vaccine gives your immune system a head start to fight and kill this. So please do not confuse the officer who shows up to protect you with the criminal. 2, I'm gonna have really bad side effects and it might kill me. Yeah, no. I mean, could somebody kill you with a COVID vaccination? Well, if they stab you in your heart with it enough times, it's a really small needle. They could possibly send you to the hospital, but no, they're not going to kill you with it. Could you have a reaction? Sure. Is it going to be a lethal or a severe reaction? No. I mean, my mom's 101. She went and got the vaccination. She's not stupid. She used to work with my dad. He was one of the few Black pulmonary physicians in Chicago. She was worked as a medical technician with him. They worked with the pandemic of their era, which was tuberculosis. When I told her to stay home, that this was a respiratory illness, she masked up. There were folks in our neighborhood on the south side who listened to oh, you don't need to wear a mask. They're much younger than she was. 2 of them are dead. She's alive. Other myths. Well, it's just people experimenting on you. No, we already did the experiments. That's why we're vaccinating folks. One of my relatives, who can be a bit crass at times, mentioned that, well, yeah, they might be trying to hurt Black folks, but there are a whole lot of white people getting this vaccination, so maybe it's okay. Other myths that, well, I'm going to wait and see what happens. Well, while you're waiting, you might get COVID. And I'm sorry, I said before, 10% of people wind up hospitalized. 10% of people who get COVID get hospitalized. And of that 10%, 10% die. Okay? So, yeah, this is just kind of foolishness from my perspective. I'm an allopathic physician. I believe in science. I believe in the healthcare we provide. And as I've said, for me, this is not an esoteric exercise. They said, oh, one of the other myths, oh, those people aren't really dying. I wish you could have come and helped us at the hospital in March and April. I've seen people put into body bags. Went and rounded on a patient a couple of weeks ago in the ICU. Went to see him Monday, went to see him Wednesday. Where is he? I asked on Friday. Oh, they moved him. Where are they moving to? Which floor? The morgue. People are still dying from this. I don't want you to be one of them. And there's a quote I want to leave you with. My kids say that I'm a little nuts on quotes, but this one is a good one. It's from Tolkien, who did Lord of the Rings. Frodo says, "I wish it need not have happened in my time." And Gandalf the wizard, the wise, said, "So do I, and so do all who live to see such times. But that is not for them to decide. All we have to decide is what to do with the time that is given us." I don't want you dying. We have something that may prevent that. You need to use it.
Well said, Dr. Payne. I've also heard these rumors that have been circulating. It's another myth that this vaccine is designed to control or eliminate certain groups within our society. To allow for mind control, of vaccinated people, or to allow certain elite members of our society to rule the rest. And these have been circulating. And then my mom, who actually is a cashier at a local supermarket, she's had customers actually say this and say, "This is the reason I'm not taking the vaccine, because this is a ploy to get rid of low-income people." Or, the things that are coming up, I sometimes wonder, where is this coming from? So where is this coming from?
Unfortunately, we live. You're unearthing an underlying issue. In the first part of the 21st century, with the proliferation of social media, people's voices could be magnified 1,000-fold, which theoretically is a really good thing, except for the fact that there is no editorial supervision of what people say. Now, when I grew up in my era, as a young man, if you wanted to get something published in a newspaper or a book, it had to go through editorial review. And folks of all walks, common sense, would say, "This is nuts." And when you put your stuff out there, people and they would allow you to print stuff that was nuts, but people who reviewed it would say, "This is nuts." And yes, some people believed it, but the majority of folks would say, "Oh, I heard that was kind of nuts." Nowadays, all information has the same weight. And I'm sorry, I'm an old guy. I believe there is such a thing as truth and justice and fairness and common sense. And so when people create myths because they so desperately want to be listened to, that they say things which are blatantly untrue, folks, let's take a real look at that last statement that you made about this is designed to depopulate Black folk. I think COVID's doing a pretty damn good job of it by itself. Don't need no help. So let us use the common sense we have. And then, of course, people want proof. Oh, Mom? They want proof. I said, I got can you come here for a second? I said I had a 101-year-old mother who took the vaccination. I'm staying in her house, so commercial rights. This is the people of Cambridge. You want to say hi?
Hi.
Hi.
Yeah. I'm trying to convince them to get the vaccine. Any thoughts?
You're trying to convince these people?
No. People who are listening.
Oh, I was just going to say they look intelligent.
Thank you. Enough said.
These people look intelligent, so.
Enough said. Thank you. That was great. So I think that, I think whatever we can do to hit back at this misinformation, whether it's on social media, and take opportunities to correct it, I think it's incumbent on us to do that. And I try to do that as much as possible, but I think it has to be really a collective effort. So we'll go to a question that was in the chat, and I think perhaps Claude, this one's for you. We have a resident wondering when and where 65 plus can get vaccinated in Cambridge.
Thanks, Mayor Siddiqui. Again, depending on their healthcare provider, they can confer with their provider first. We don't have a site right now, a public site where we can provide vaccinations to our 65 plus. As I mentioned about the mobile teams with limited vaccines, we've been focused on the public housing buildings. We're now looking at some of the private housing developments. So this was news last week that as of, I believe, last Thursday, those in this category, this group of 65 plus and with 2 health conditions, they are now eligible. So we do not have a public vaccination center in the city. We're working on trying to at least have a regional site. The limited doses that we do receive, we're taking it to some of the buildings. So we've gone to the larger public housing developments that Brenda could speak to. So we would suggest that this resident confer with their provider. I know that the Cambridge Health Alliance, we just activated a vaccination center right in Somerville. I believe it's at 176 Somerville Ave. Those are for Cambridge Health Alliance patients. You need an appointment. There's a whole process to go through that. I know that our friends at Mount Auburn, they have a clinic right there on Mass Ave, but we also are aware of some constraints even with the healthcare providers. So check with their provider first. We have encouraged folks to try to call the 211 line or the state. We've heard some challenges there, but at the end of the day, we're working on making sure we get the limited doses out to pockets of the community. We just don't have a public clinic available as of yet.
And we heard this last night, but to reiterate, if you are a Cambridge Health Alliance patient, you can go and make an appointment in Somerville. I think it's right near the Target parking lot.
Right, 176 Somerville Ave is the address. It's next door to the Target. Plenty of parking, and I believe the hours are between 8:30 and 4 p.m. But again, you need an appointment in order to be able to access. They don't take walk-ins.
So for those listening, the provider is the best way to go. And the way we were able to get my mom an appointment was just through the vaxfinder.com and refreshing. And we were able to do that for the Fenway site, which provides parking. Well, it's like a $5 fee for parking. But again, to that point of, usually you'll need some help. And I wish, we do have the transportation through Somerville and Elder Services, and they are providing transportation. So if you are having difficulties with transportation, let us know. We'll provide that contact information, and we want people to know that it shouldn't be a huge issue. Obviously, some of the sites are, Gillette, Springfield, they're very far, but even locally, I know that we have a city that does not have that we have residents who don't rely on cars and public transportation. People may be nervous to get on it. So let us know if you do need rides. We want to help. So in the time that we have left, I think what I will do is, I think there's no more. Let me just check if there's questions in the chat. Don't see any more questions in the chat. So I will ask, I think maybe we can go around one more time and hear from the group. I think, what are some of the things your family and friends have said as to why they're hesitating about the vaccine, and how you may or may not have convinced them? I think, Superintendent, we can start with you. Your parents got the vaccine. Were they nervous at all? Have others said anything to you?
Sure. So my mom, she lives in a senior community, and she was just watching people, as Dr. Payne said, just dying. And so they were really anxious to get the vaccine just so that they could return to some sort of a normal life. So they were ready to get the vaccine. My sons are a little bit mixed. I have one son who's an athlete who says, I'll just quit sports, but I think he'll get past that. My other son is absolutely willing to get the vaccine. Some of the things, and to your question earlier, I think people are talking about long-term effects and things of that nature that I really can't answer to those questions. But what I'm saying to my sons is that we need to return to a normal life, and or some kind of a normal life, and really getting the vaccine is going to be key to that. So just as much information as the professionals can give us. Listen to our healthcare professionals. They have the information. They are not going to lie to us. So, direct questions there. And I absolutely would recommend, if you have questions, go to your healthcare professional. I am fine. I'm excited that I got the vaccine, and I'm excited now for life after the vaccine.
Great. How about you, Commissioner, Executive Director Downing?
So for me, I've had mixed opinions from different members of my family, and it's across different, different age brackets. For instance, my youngest son, he's still skeptical about it, but like Deputy Superintendent Elo, he's an athlete. He's a freshman in college, and I think, because my husband doesn't really whisper, but I think he just called and said that they just canceled his basketball season. His first game was supposed to be Monday, and I think perhaps someone may have contracted COVID. He's still a little skeptical, but we keep talking to him about it, about the importance of it. Again, I told you about my 87-year-old mother-in-law, but then we have, everyone in between ages that, are looking forward to getting the vaccine, when we can. I mean, I think back to, back in February of last year, I actually had COVID, because that was back when you couldn't get tested. I was going to work, and it was a time where for like 3 days, I didn't feel well. And I never take that much sick time. But then I remember right after that coming back to work, but I couldn't taste. I had no sense of taste and no sense of smell. And this was before folks were talking about that was a side effect. And then I remember my boys, my two sons, had gone to the Celtics game, that Utah Jazz game, and that player who touched the microphone and things like that, then he had contracted COVID, and then he tweeted out, "Hey, I've lost my sense of smell and my sense of taste." And has anyone else experienced that? And I was like, oh my God, I must have had it. But again, back then, we couldn't get tested, right? Like the testing was just for, athletes and famous people and things like that. So, I think that, so I was never able to get tested, but I do think that for me, that kind of helped me shape the decision that I wanted to get vaccinated when I could get vaccinated. So both myself and my husband and my older son, we're looking forward to, when we can actually get vaccinated. And I think my youngest, he'll come around, because I'll make him come around.
Thank you. Thank you for sharing. Dr. Payne?
Actually, something you said was very important. If you've had, or you think you had COVID, you still want to get vaccinated. It is not uncommon for the human body to have an immune response to an illness, but then not have it be protective. There's a disease called hepatitis B, where that's classic. Something like 80%, hepatitis C, something like 80, 90% of people who get the infection create antibodies, but they don't protect you from the actual virus. Now, it's a little different than COVID, but we suspect that many people who got the COVID infection are not resistant to getting it again because they don't have the right antibodies. This vaccine was developed specifically to have the right antibodies. Simply put, the football analogy again, this vaccine has, frontline players who are really good at getting through the defensive line and sacking that quarterback. Okay, they are going to take COVID down. Now, the team will shift, and they may have to get some new players, a revaccination. But just because you had COVID does not mean you have immunity. So please get revaccinated.
And while we're talking about that, I think I've also seen, now people are getting vaccinated. They're like, okay, I don't need to wear the mask anymore. I don't need to, social distance. Can you clear that up for people?
Yeah. See, I love irony. And the irony of, the Tuskegee Stuggy killing people in the 21st century because they won't get vaccinated. But here's the irony. When COVID first came out, the 18 and 20-year-olds were walking around saying, hey, I'm young. If I get infected, it won't be that bad. Actually, it is, because many of them have long-term problems, breathing and other stuff, but that's a different story. But they were walking around. So, us folks who are older, I'm 65, we're wearing masks, and we're, like, oh my God, go across the street. It was funny. There was some kids standing there, and my son and I crossed the street to avoid them because they weren't wearing masks. Well, for those who got vaccinated, now it's our turn. So now the 18-year-olds have to run across the street. So all y'all get vaccinated, you need to put your mask on, because we got to protect these foolish people who aren't wearing masks and don't know any better. But yeah, sometimes turnaround is fair play.
Yes, absolutely. That's a good point. So, Claude, anything that you've explained to your friends and family?
Yeah, thank you. I really appreciate this conversation. I've been reflecting about this journey the last year. I made a decision early on given the nature of my work, running a health department, not to proselytize to family members. Like I literally realized the hazard tied to all the unknowns. But on the flip side, I made a personal decision. And I recognize that even my own family members and colleagues, everyone's at a different place. Whether you're eligible or not, whether you're patient enough to navigate the platforms and the call centers or whatnot, what I would say is that having had conversations with my own parents, again, they're two retired clinicians. I trust the science. I believe in the science. Like Dr. Payne was talking about this. So for me, it was an easy decision. But the reason I made that decision is because I really wanted to make sure that I protected not just myself, but my loved ones. I didn't want someone else to get sick because of me. And so that is deeply personal for all obvious reasons. But I would say to folks, again, it's a personal decision. If you're ready and you have access to the vaccine, take it. To Dr. Payne's point, the misnomers around, do I grow an extra arm? Does my nose turn green? Like, again, dispel the rumors, trust the science, trust the facts, make that decision. But at the end of the day, we're asking folks at this time to be patient with the process, given this dribbling effect with getting ample vaccine out by priority, because there are folks who are at higher risk. We've got to get to them first and then make our way to the broader population. So still having conversations. I'm glad that some of my family members have been able to at least be eligible and take advantage of the vaccine. My folks, they live in Florida, still haven't been able to book an appointment. And again, they're up in age and I think about it, but I'm just trying to, again, practice what I preach and be patient with that process. They're trying. It just means that it takes a lot longer to book that appointment. So.
Yeah, and you look across the country, I think every state is a little bit different in what the rollout looks like. My twin brother lives in Austin, Texas, and they've had a tough time down there for the weather reasons, but they were able to get appointments and vaccinated. Same with family in Mississippi, cousins and all ages. So the approach has been different, and we have gotten a lot of questions of, my friends and family in this state, they've been able to get vaccinated sooner. Why is Massachusetts doing X? Why is Cambridge doing Y? And I think, to that we've said, well, it is going to look different. And I think here we have to work very closely with our state department, who is working very close with the federal government to figure out how to get more vaccines. So it's these tiered levels. But I think, we have another question that's come up around this. You're a Cambridge resident, CHA is not your provider. Do you have to wait for a public center to be opened? And right now, based on what Claude has mentioned, we have those mass vaccination sites, and then going directly to your provider, whoever it is, and scheduling through them, calling them to see what's possible is probably the best route at this point.
Yes, it is. And again, we're here to serve. We're here to help. So if that resident wants to contact us, again, we can help navigate. We don't have all the answers. We clearly don't have vaccines sitting in our back pockets, but we're doing our best to get to the higher risk pockets of the community. And we're asking folks to be patient with the process. So feel free to contact us, whether it's through the mayor's office directly or to make sure to connect with us. And we can at least talk you through, because that's what we're also finding. Folks just need to speak to a live voice. So our public health nurses, again, I can't tell you enough about the talent in that group. Our staff, we make ourselves available to at least help folks navigate.
Great. And my final question just will be one last takeaway that you can share with the public right now before we wrap up. So we can go with Superintendent Elo.
I'm going to reiterate, please get vaccinated, please.
Deputy Director Downing?
I think my takeaway would be that everyone should follow Dr. Payne's mother and get vaccinated. She's 101 years old. She's absolutely amazing. And we want to have her around. We want to have ourselves around. So I think that if she's doing it and she's not scared, then, no excuse for anybody else.
Claude?
Yeah, really, recognizing that it's a personal decision, really, we encourage folks to get vaccinated. We're asking folks to be patient with the process, but really, at the end of the day, It's to protect yourself and your loved ones. Trust the facts, get the vax. I know that that's a statewide campaign, but I would say to folks, really protect yourself and your loved ones.
Dr. Payne.
Smallpox, polio, diphtheria, tetanus, influenza. We've used vaccines to fight all of these diseases to a standstill. When's the last time you saw somebody who was basically in a wheelchair because of polio? We don't see smallpox anymore. It may still be out there, but vaccinations work. I have a slightly different take than Dr. Jacob. I'm a practicing clinician. I don't want anybody to die. This is one of the few things we have right now that can prevent that. Is it hard to get a vaccination? Yes, we don't have enough of it, and we're rolling it out. It'll get better as the year goes on. People will have to be patient. My wife hasn't been able to find a slot to get vaccinated in. You know, we're anxious about that. But here's the thing. If you've ever wanted to go to a concert like Prince or the Rolling Stone or whatever, you know, artist you love that's available right now, you know how hard it is to get tickets. And has that stopped you from, you know, hitting refresh every 5 minutes or calling up or keep looking or calling to different towns? Well, if you can get a concert to go see, you know, J-Lo, you can get your vaccination. Okay? God bless and good luck.
Absolutely. Absolutely. I've seen Celine Dion twice. So I have refreshed that and gotten tickets. So thank you to all our panelists for being here tonight to answer community members' questions about the COVID vaccine. I think we've hit on a lot of good points that around the myths and how to combat some of the misinformation. You know, if we were unable to answer your question this evening or you have additional questions, you're welcome to reach out to the Cambridge Public Health Department, to my office. Our number is 617-349-4264. I want to thank the Cambridge Community Television for streaming this important discussion on their Facebook Live channel and Channel 8. And I really do hope that this is the start of many conversations that the Cambridge Public Health Department and community members will continue to have about the vaccine safety and efficacy. And another shout out to our teams that help us do this work. My Chief of Staff, Madeline Cormick, and Jody Silverman from the Cambridge Public Health Department for all their help in putting together this program tonight. So to everyone, stay safe, mask up, Cambridge, and get your vaccine. And we will be sharing any updates we have with the community as the rollout continues. Our goal is to get everyone who would like the vaccine, and we really want you to get that vaccine to get it. So thank you and good night.